The Mojo 2 vented mask by Sleepnet is designed to provide optimal respiratory support for home care and CPAP patients. Ensure you have the Mojo 2 vented mask, headgear, and any necessary ventilation equipment. Wash your hands thoroughly and ensure the mask and components are clean and ready for use. Use the size guide that comes with the mask to verify the mask is the correct size. When using the size guide, ensure your mouth is slightly open. Line the top of the guide to the bridge of your nose and select the smallest size that does not restrict your nose or mouth. The appropriate size may be smaller than expected due to the design of the mask. To assemble the mask, start by removing the magnetic clips from the Mojo 2 mask and placing them on the table. Lay the headgear flat with the light gray side facing up and the Sleepnet logo facing down. And thread the longer straps through the magnetic clips, making sure the magnet faces the same direction as the light gray strap. Flip the headgear so that the short straps are closest to you. Tilt the mask gel side down and thread the shorter straps through the forehead slots. Then connect the magnetic clips back onto the mask. If you are a first-time user, start by putting on the mask in front of a mirror. If necessary, please remove any eyewear before proceeding. Unhook one or both clips and place the mask on your face. Seat the bottom cushion at the crease of your chin. Tip the mask up to contact your nose and reattach the clips. The mask may sit lower on your nose than expected, depending on your facial features. The headgear should lay flat across the back of the head. Ensure the headgear is centered by aligning the two straps. Then, pull the straps back, adjust the strap tension, and affix the tabs. Turn the forehead adjustment dial to adjust tension until you are comfortable. If necessary, readjust the top straps for a comfortable fit. Check for any pressure points or discomfort, then adjust as needed. To ensure a proper fit, avoid over-tightening the mask. This will help to prevent skin irritation and sores. The ergonomically designed air gel provides a shelf that folds in when touching the patient's nasal bridge. This reduces pressure on the nasal bridge and prevents over-tightening of the mask, which can lead to skin ulcers. Once adjustments have been made, connect the mask to the ventilator tubing and follow the equipment manufacturer's instructions for use.